Hi Grand Oaks family, this video will give you a quick overview of our ghost clinic procedures at our amazing school. There will be a lot more details coming at you guys next week related to COVID specifically. My name is Becca Edge. I'm the school nurse. I've been a nurse for 12 years and I'm really excited to join this team of wonderful educators. This year will look different, but I know it's going to be a great one. Let's jump right in. The clinic hours are 8:10 a.m. to 4:05 p.m. If you need medical assistance before or after hours, please call admin or 911 if needed. The extension here at the clinic is 5005. The clinic will be closed daily for lunch, except for emergencies, of course, and that time is to be determined. This is our nurse pass this year. Please remember to put your student's full name and your name on the nurse pass. Only one pass per student, please, and all students coming to the clinic must wear a mask while they're walking here and while they're in the clinic. This is our red bags. These are used to treat minor emergencies in class. They have basic first aid supplies inside. New for this year are Q-tips and Vaseline for chapped lips, wipes, masks, tooth chests, and stop the bleed kits for some of them. You will turn these back into the clinic at the end of the year, so please do not write on them. You are able to include other items as needed, just please no medications, and remember to use universal precautions when dealing with another person's body fluids. Please wear gloves and please wash your hands. These are AEDs. We have 3 of them in our school. This is what they look like from the outside, and the picture on the right is the inside. Remember, when using an AED, call for help, stay calm, and follow the prompt. It will tell you exactly what to do. The shock button will light up when a shock is needed, and it is right where this arrow is pointing. These are the locations of our AEDs. We have one right outside the nurse's office, one in the cafeteria, and one in the hallway that leads to these 4 pods. When do I send a student to the clinic? Vomiting, not just spitting up or phlegm. Diarrhea, more than one trip to the bathroom. Bleeding that is more than a paper cut or a pig scab. Animal or insect bite. Headache or stomach ache or just not feeling that well that persists beyond 20 minutes or is extremely sudden and severe in onset. We do ask that you try simple things like water and letting the student lay their head down for 20 minutes. If they still aren't feeling well, please send them to the clinic. Nosebleeds, ask the student to use a tissue and pinch their own nose closed for 5 minutes. Please ask them not to blow or pick their nose, and if the bleeding continues after 5 minutes, send them to me. If a student is obviously ill in appearance or the behavior is different from other days and you're concerned, I'm happy to evaluate them. Symptoms of infection such as redness, heat, pain, swelling, pus in any area needs to be seen by me. Earaches need to be seen. Undiagnosed rash, suspected head lice, or sore throats need to be evaluated in the clinic. Any injury to the head, eyes, face, or ears needs to be assessed by the nurse, and the parents will need to be notified. If an injury is severe, such as severe bleeding or loss of consciousness, please call for me to come to you right away. On that note, seizures, call for me and I will come to you. Difficulty breathing and choking is an emergency. Call for me and I will come to you. Burns, begin flushing the burn with cold water to stop the burning process and I can come to you. Exhibiting symptoms of a known chronic illness such as asthma, diabetes, migraines, ulcers, and severe allergic reactions need to be evaluated by the nurse. I will share information as it pertains to individual teachers for their students that have these conditions. Severe allergic reactions are emergencies and need to be seen right away. Bone and joint injuries such as fractures, dislocations, sprains, and strains, please make sure the student does not move, bend, or bear weight on the affected bone and joint. If a fracture is open, that is an emergency, call me and I will come to you. For serious falls or accidents where the head, neck, spinal, or major upper leg injury is suspected, do not move the student, please. Send for the nurse, I will assess the student, and we will determine if emergency medical services need to be called. What can we do to keep our students safe and healthy this year? Let's all encourage and model frequent hand washing, social distancing, and mask wearing. Let's encourage our students to cover their coughs and sneezes. Let's encourage hydration, healthy habits, and lifestyle. Let's work as a team to keep our schools safe, healthy, and face-to-face. And if you aren't sure what to do, just call me. Again, my extension is 5005. We are in this together, and I know it's going to be a great year. The nitty-gritty word is gecko.